How to make an appointment. There are multiple ways of creating an appointment. You can go and click on New Appointment, and you can search for the patient or the client name. So you can do it. If I was searching for Charmander Doe, I could start typing in Charmander, or I can search by the last name as well. This is one way that you can click and start the process. The second way that most people find easier is to scroll and find your open appointment at the time that you're hoping. So if we wanted to put Charmander in at 9 a.m., you find that opening, you click on it and do the same search feature, but it helps keep you more organized by looking and seeing the specific time and clicking on it. And then when you're in this screen, it defaults to that time that you just clicked on to help make it easier for you. So in this screen, you'll see alerts such as, did they ever miss an appointment? This is important because if we do have too many missed appointments, we do start charging a deposit to be able to be seen. The other things that's important is that you'll see alerts. So if there's alerts on here, we might know that we need to do some pre-visit pharmaceuticals. So high FAS, once you complete your fear-free training, you'll know that this is a patient who's very fearful. We want to make the appointment easier on that patient, more enjoyable, and even more thorough by having a more relaxed patient. So we will talk to them about prescribing pre-visit pharmaceuticals that they need to pick up in advance from their appointments and give 2 hours prior to coming in. So this is something we need to address as we're making this appointment. There might also be a client alert. This one is a specific pharmacy called CVS, so they prefer that. Next thing we have to know is what type of appointment are we creating. Each of these has a default time based on how long it takes. Examinations default to 40, whereas our simple wellnesses are 20, and our complex wellnesses are 30. The difference between the simple and complex wellness is there a lot of questions the owner has? Or is it an older patient and the odds of us finding multiple things to discuss or treatments that need to be done or diagnostics to be performed? So we should give ourselves more time. You can even manually adjust this as well using this area just in case that needs even further additions. Maybe you feel like they need a really extended time. This is a great area that you can adjust. Or let's say we're bringing in multiple patients. Therefore, we can't just do a 30-minute wellness for someone who's bringing in 2 patients. We need to extend that appointment. That way we can give each patient at least 20 minutes of time. So we should manually change that to 40. The status is something that will automatically default to planned, and then as we confirm or if they respond to the text messaging, then it will change to confirmed and then move from there. This is where you can change later, like we said, to say it's a no-show or say it's canceled as well. You always want to verify that you picked the right date and time that you were hoping to. So make sure you have this. You really want to make sure to read that back to the owner so there's no confusion. And usually these two will default to just say the provider, which is myself, and then the schedule. The schedule portion, we really change this mainly for our technician appointments, where you'd click and do technicians and it would manually move it into the column, or you can click and drag as needed to on the other screen. Department, we ignore that, but we definitely want to put information for reason for visit. Is it a vaccination? Do you know which vaccines they need based on being in the record? Let's fill that out. Examination, what are we looking at? Is it a vomiting and diarrhea dog? Don't just put exam. Elaborate so we know going in there what we need to start asking. The more the merrier. If it's a new client, what is the clinic we need to call for records? And has that been done yet, or do we still need to? If we still need to, there is an area we'll demonstrate of creating a task so we can remind ourselves to call for those records find the records, and input important data like historical vaccinations and medications as well. So put everything in here and make sure that that is there. Sending a confirmation email is a default. It's a great idea. Please always make sure that's there. We like people to get lots of knowledge about their appointment, so hopefully they don't forget. And then when you're ready, you hit book. So for this, we picked, what did we pick? A complex wellness. And we're going to say that it's going to be rabies only today. He's up to date on everything else. So we're going to put that here and hit book. And then what you'll see is, uh-oh, where did it go? I don't see the appointment I just created. Sometimes it does that if the system is being sluggish. Just hit refresh. Fresh is always your friend. And go back to that day and you should be able to see. And there it is. It was just hiding. And like you can tell, this was the alert that tells us, uh-oh, this one has patient alerts that I better click on and pay attention to, like the fearful portion, as a reminder. So this is a great way that if we're manually doing confirmation calls, that we look and we make sure, did they get their PVPs picked up, and remind them to give them 2 hours prior to coming in, and bring any favorite treats and information like that as we need. So that sometimes we even let them bring their favorite toys. So anything like that is helpful. So here is this information, and we will go over how to start an appointment at another video.